guys, this is Dr. Nida with Keys of Health. Have you heard about candidiasis? Candidiasis is an infection that is caused by a yeast, which is a type of fungus called Candida. Some species of Candida can cause infection in people. Candida normally lives on the skin and inside the body in places such as the mouth, throat, gut, and vagina. In this video, I'm going to talk about yeast infection in the mouth. I will talk about vaginal yeast infection and how to treat it naturally in a separate video. Yeast infection results in some white patches on the tongue, some red areas, and burning sensation in the mouth. Yeast infection is also known as oral thrush or oral yeast infection or candidiasis. It is most common among elders because their immune system is somewhat compromised, and it is also common among infants, people who have been on long courses of antibiotics because antibiotics destroy the natural bacteria that inhabit mouth, gut, and other parts of the body. And when that bacteria, good bacteria, is destroyed, this yeast has an opportunity to take over. It is also common among people with compromised immune system, people who have diabetes and HIV. Those who use corticosteroids like asthma inhalers can also get candidiasis because it creates an environment in the mouth where getting the infection is easier. Also, people who use dentures and retainers should be careful and disinfect them after each use. The easy way is to soak them with salt water or water with some baking soda dissolved in it. I will talk about it in a little bit. Candida thrives on sugar, so people who eat a lot of sugar or starchy foods are also more susceptible to this yeast infection. Again, it looks different for different people. You may have white spots, the whole tongue may be white, it might bleed, there might be odor, it can be very uncomfortable. It is best to get a proper diagnosis, and you don't want to ignore it because it can spread to other parts of the body like your throat. And you also want to remember that once you develop yeast infection, there is a good chance that it will recur. So taking preventive measures once you have developed it is also very important. As always, I will give you the inside-out approach on how to repopulate your good bacteria internally and meanwhile take care of this nuisance externally. So what should you do if you start to notice white spots in your mouth or have gotten a diagnosis for Candida? First, start gargling with warm salt water. Add a teaspoon of salt to slightly warm water and rinse your mouth with it. Rinse for a minute about 3 to 4 times a day. Another thing that's really great is hydrogen peroxide. Hydrogen peroxide is something I always keep in the house. Half water and half 3% hydrogen peroxide. Mix it together, rinse for a minute 3 to 4 times a day. Keep doing it until the infection is completely gone. Another thing you want to do is try switching to an herbal toothpaste. Along with that, you want to brush your teeth at least once a day with baking soda. Simply add a little bit of water to baking soda so it has toothpaste-like consistency and brush your teeth with it. You can even brush your teeth with some bentonite clay once in a while. That's also very helpful in alkalizing the environment of the mouth. If you wear dentures or retainers, disinfect them. Like I said earlier, the easiest way is to soak them in salt water, water with baking soda dissolved in it. You can add some white vinegar to the water and soak your dentures or retainers, or even simply in some mouthwash solution. The main point is to disinfect your dentures or retainers regularly. Change your toothbrush frequently. If you have an infection, disinfect your toothbrush regularly until the infection is gone. Because if the toothbrush is contaminated and you use it again and again, you're reintroducing the fungus in your mouth. You're reinfecting yourself. Now, pay attention to this one. It is amazing but very potent, so you want to be careful. Get some clove oil. Take a cup of water and add 10 to 15 drops of clove oil to it and rinse your mouth with it. It's amazing for toothaches, receding gums, tartar, and even yeast infections. If these things don't help, then your dentist might prescribe something stronger for you. Now let's talk about what you can do internally to help heal the yeast infection and prevent it from recurring. First and foremost, healthy diet. You want to have colorful fruits and vegetables, not just some potatoes and onions and apples all the time. You want to have a variety. Second, drink plenty of water. Next thing you want to do is include antimicrobial foods in your diet. These include garlic, onion, ginger, turmeric, cinnamon, and clove. They are amazing. You want to have them in your system on regular basis to prevent any fungal infection. And once you have a fungal infection, you want to increase the amount to make sure they can help heal and get rid of that infection. Add probiotics like yogurt, buttermilk, kefir, kombucha, sauerkraut, and kimchi in your diet. This really helps replenish the microbiome in your gut. And I would recommend taking probiotic supplements as well. It helps your body in many ways. And when you have a yeast infection, it is extremely beneficial. I have done a video on this topic, so make sure you check that out to get a complete understanding of how probiotics can really help you. If you take this as a package, you will see a significant difference in a very short time. Please share this video with your friends and family so we can help others take advantage of these natural treatments. Please support my channel by subscribing. I will see you shortly with another video. Until then, take care. Goodbye.